Hey guys, so this is Dr. Crawford. So one thing that we work with a lot here are pediatric anoxic brain injuries. And so I get a lot of questions about neurostorming and about tone, like muscle tone and locked in syndrome and these types of things. And so I think it'd be beneficial just to kind of go through what the research says and like what my clinical findings are telling us about these issues. So first thing is we know that there are several areas that are primarily affected by these types of brain injuries. Number one are going to be areas of the basal ganglia. Okay. Number two is going to be the cerebellum. Okay. Number three is going to be an area called the frontoparietal lobe. Now, this is actually stated in the research, is where I'm getting this information from. And there's various reasons for each network. Now, specifically, regarding the muscle tone issues and the locked-in syndrome and that kind of thing, let's talk about this basal ganglia thing real quick. That's largely affected, and that's the primary area affected in these kiddos and adults, okay, because of the arteries called the lenticulostriate arteries, okay? The lenticulostriate arteries are going to supply various areas within those deep regions in the brain. Typically, they come off of the middle cerebral artery, which is the main supply to them, and then they go into the deep regions of the brain, specifically into the basal ganglia, but they highly supply the posterior limb of the internal capsule. Now, the importance to that is that if we kind of extrapolate this and we draw the internal capsule, this is where motor fibers run through, all right? So motor for our legs, motor for our trunk, motor for our arms, and motor for our face, and it's kind of laid out like that from back to front in the internal capsule. And so as these fibers are coming through this posterior limb of the internal capsule right here, which these arteries are supplying, if this area is damaged more, this creates more of a motor problem, right? So this really damages our motor systems. And this is called deafferentation syndrome. This is also known as your locked-in syndrome. Okay? Now, the thing that's really, really important to note about this is that this is primarily a motor-based problem. It doesn't mean there's not other problems associated with it, but in hospitals and things like this, it's very common for parents to be told that, hey, your kid's just not present. They're not there, they're gone. Pull the plug, this kind of thing. But here's the thing, is that if this is mostly a motor-based system or a motor-based problem, they're still cognitively aware about their surroundings, about things that are going on. They still feel the environment, and the research is telling us this, okay? So this is, in a nutshell, where we're getting all these motor issues, the locked-in syndrome, and all these muscle imbalances whenever we have an anoxic brain injury like a non-fatal drowning, or for various other reasons, whatever may stop a heart or breathing problem, whatever stops oxygen into the brain. So again, this is just one little snip of what's going on. Thanks.